Module 5, Blood Pressure. Blood pressure, it's more than just numbers. It's one of the most important indicators of heart and circulatory health. In this module, you'll learn what blood pressure really means, how to measure it correctly, and how to interpret the results. Definition and physiology. Blood pressure is the force exerted by circulating blood on the walls of the arteries. It's measured in millimeters of mercury, mmHg, and has two components. Systolic pressure, the pressure when the heart contracts. Diastolic pressure, the pressure when the heart relaxes between beats. This balance between contraction and relaxation ensures oxygen and nutrients are delivered efficiently throughout the body. Normal range and classification. For a healthy adult, the normal blood pressure is around 120/80 mmHg. General classifications. Normal, less than 120/80 mmHg. Elevated, 120 to 129, less than 80 millimeters of mercury. Hypertension stage 1, 130 to 139/80 to 89 millimeters of mercury. Hypertension stage 2, 140/90 mmHg or higher. Hypotension, below 90/60 millimeter of mercury. Always remember, readings may vary slightly depending on the patient's condition, age, and posture. To measure BP manually, you need sphygmomanometer, the BP cuff and gauge. Stethoscope, to listen for the Korotkoff sounds. Ensure all equipment is in good working condition and appropriately sized for the patient's arm. Using the wrong cuff size is one of the most common causes of inaccurate readings. Step-by-step blood pressure measurement. Ask the patient to sit comfortably with the arm supported at heart level. Wrap the cuff snugly around the upper arm, about 2 to 3 centimeters above the elbow crease. Place the stethoscope diaphragm over the brachial artery. Inflate the cuff until the gauge reads about 30 millimeters of mercury above the expected systolic pressure. Slowly release the air, 2 to 3 millimeters of mercury per second, while listening carefully. Note the reading at first clear sound, systolic pressure. Point when sound disappears, diastolic pressure. Deflate the cuff completely and record the reading accurately. For accuracy, repeat the measurement after 1 to 2 minutes on the same or opposite arm if necessary. Common errors and abnormal findings. Avoid these frequent mistakes. Cuff too loose or too tight. Patient talking or moving during measurement. Measuring immediately after exercise or caffeine intake. Arm not at heart level. Abnormal readings such as very high, very low, or uneven results between arms should be reported promptly. Remember, blood pressure can change with stress, emotion, or illness. That's why consistency in technique is crucial. Let's recap. Blood pressure is the force of blood against artery walls. It's expressed as systolic over diastolic pressure. The normal range is around 120/80 mmHg. Accuracy depends on good technique and patient preparation. In the next and final module, we'll explore pain assessment, the fifth vital sign that provides insight into a patient's comfort, well-being, and overall recovery status. See you in the next class.